right? All right, you ready?
I already started.
Oh, cool.
Oh
All
my
right,
gosh.
so I'm Cameron Eldred. Today we're going to be talking about a dynamic hip flexor routine that I've been doing with a couple of patients that I work with. To start off, we've got a roll call. So we've got Elena,
Here.
Isaac,
Hi.
and Max, and myself. So before we start any of this, how many of you have ever dealt with a hip flexor issue with an athlete or a patient?
Me.
And how long, typically, for you guys noticed, do these linger?
Forever.
Right?
It's like,
They're terrible.
Yes.
And if you've ever experienced one yourself, it's the worst thing ever, and you just want to shut yourself down and never do anything ever again. It's absolutely horrible. Now, in order to kind of help prep for hip extension in the patients you're working with, I do these specific exercises as much as possible, especially when warming up and things like that. I found that a lot of the patients that I work with truly appreciate these and the corrections that I give them when they're performing the exercises. So what we need to remember is when we're doing these exercises, the first thing that we're trying to look at is we're trying to hit like psoas major, the iliacus, as well as one that kind of surprises a lot of people are adductors. It's kind of surprising the amount of people who think, oh, well, why in the world are we going to hit adductors? Like, that doesn't do you a whole lot. But if you actually think about it, say you're trying to do like a sumo deadlift. Okay, so you're down, you're in kind of an outward position here, you're trying to get down and come up. Well, those adductors actually have a lot to do with the hip flexion motion that's going on right there. So those are the three things that we really want to look at. Now, there was an article that I read that looked at the etiology of hip flexor mechanism and things like that. Men's soccer and men's hockey actually have the highest rate of incidence for hip flexor issues. Up to 30% of them have a reoccurrence rate. So this is something that repeatedly comes back. So putting the patients that you work with on some type of a maintenance program is going to be very beneficial for them. Also, just so you guys do know, 62% of these involved adductor strains.
Yeah.
So obviously, there's a lot going on there. So the first thing that we're going to do while we go through these motions is, Elena, would you mind being a person for me? So the first thing that we want to focus on when we're doing all this and to keep in mind is our hip position. So what I'm going to go ahead and have you do is I just want you to get on one knee, put one knee forward. Okay, so a lot of the times when we have our patients do a hip flexor stretch, we've got them right here, hip flexor stretch. So they're leaning forward, right? So go ahead and lean forward. How well do you feel that in your hip flexors? You don't. So you can come back up. So the biggest reason is if you look at her body posture, okay, she's tilted forward and she has an anterior tilt in her hips. Yep, exactly. So the biggest thing that we want to do is we're going to want to utilize our core. So we want to kind of suck in and you're going to want to tilt that pelvis back a little bit if you can. So you want to rotate your hips back. Now lean forward. You see that? She doesn't even have to go nearly as far as she was.
it works.
So that posterior tilt movement is going to be key to all of this. So squeezing those glutes, getting that posterior tilt. So that's the first exercise that I always have them do, first stretch. So you can come back up a little bit. The next one that we're going to go ahead and focus on, and this kind of helps guide this, is the psoas stretch. So you're going to get in that same position for me. Okay, you're going to squeeze those glutes, get that posterior tilt pelvic movement. What I want you to do is you're going to rotate towards me. Yep, there you go. And I want you to reach this arm up, and then you're going to lean that way into it. And you should feel that right there in that psoas muscle. You should really be able to feel it, especially with that posterior tilt movement. Again, posterior tilt, posterior tilt. Always focus on it when you're doing this. Okay, good. All right, so the next one we're going to do, not nearly as hard as that one, so we're going to focus on those adductors, okay? So we're going to be in the same position. You're just going to take it out a little bit wider, okay? And you're just going to put your hand here. You're not going to push. You're just going to use it as stabilization. And all you're going to do is you're going to lean into it like you normally would, and then kind of go into your leg a little bit. But remember, focus on that posterior tilt, and you should feel that right in those adductors. Yep.
Yes, to do.
Exactly. All right, so you can come back up now. So the last one that I really like to focus on is the rectus femoris. You know, a lot of people tend to forget about this one as a hip flexor, but if you think about the insertions and everything else, it's right there. I mean, everything works out for you. So what we're going to go ahead and do, this is a little bit more advanced, but an easy way to do this is, Elena, if you want to... Okay, so what I'm going to have you do is, I'm going to show you first. Okay, so all you have to do, if you have a better stabilizing chair than I do, it works out a little bit better. So what you do, put your knee on the chair, you're going to put your leg up on the back here, and all you're doing is you're just pulling into it and you're going to lean forward into this, okay? Now, there's a more advanced one that I can't do. We're going to see if Elena can do it, but we're going to do it on the floor. Okay? So what you'll do is you're going to get on down into that hip flexor position that I had you in. Okay? And you're going to grab, you're going to grab right there, and pull that forward, and then you're going to go into that hip flexor position. Now remember, you got to tilt that pelvis back. Okay? And you should feel that, and you can actually see her rectus femoris come out right here because she's so tight. All right, you're good. Thank you. So just remember, when you're doing all of this, the glute is going to be key. You're going to tighten up that glute, okay? You're going to get that posterior tilt. You're going to feel all that stretching. These are just a few of the stretches that I do with my athletes on a regular basis, with the patients that I work with on a regular basis that have hip flexor issues. I can positively say that this has a great effect on any patient that I've ever worked with. They absolutely love these stretches. And I've had other people mention, you know, I'm glad that you're incorporating things other than just this general area, the hip flexor area. Something that we have to remember is that there's so many other muscles that attach to that site that we need to be focusing on as well. So thank you.
That was really good.